I'd like to welcome everyone to the Vasculitis Foundation webinar today. We're going to get started in just a minute, but I'm going to go over some details first. I'm Kathy Olewski. I'm the host for the Vasculitis Foundation Educational Webinar Series. I'm also a patient living with MPA vasculitis. Today's webinar topic is demystifying the medication access process and insurance authorization. And we are super excited to have Rachael Perritt with us today to educate us and answer some questions. Let me introduce our speaker today. We have with us Rachael Perritt, and she is the clinical pharmacy specialist in rheumatology at the Hospital of the University of Pennsylvania. She's been practicing pharmacist since 2006 with experience in emergency medicine, primary care, value-based healthcare, and rheumatology. And prior to her clinical practice, she graduated with a Doctor of Pharmacy from Rutgers University and completed postgraduate training at Temple University Health System and Robert Wood Johnson University Hospital. Professionally, Rachael focuses on medication access and education while also precepting resident pharmacists and working on research projects relating to the treatment in rheumatology and pharmacist-focused clinical initiatives. So Rachael, thank you so much for joining us today. And I just want to say, I don't want to not respect you properly. Do you go by Rachael or Dr. Perritt?
Only my students call me Dr. Perritt, but everyone can call me Rachael.
Well, thank you. We appreciate that today. So thank you so much for joining us. And I think what I'd like to do now is just ask you to go ahead and share your screen and start educating us. We're anxious today.
Thanks so much, Kathy. All right, let me share my screen and bring up the PowerPoint presentation. We're going to switch this up. All right. All right. Kathy, are you able to see my slides?
We do see it. Thank you.
Excellent. Thank you so much. So I am very happy to be here tonight presenting and talking about demystifying the medication access process. I'm going to be talking today about insurance authorizations, appeals, and copay assistance. So as for disclosures, I have previously received honoraria from Janssen Pharmaceuticals, nothing to do with this presentation. So the first step in the medication access process is that your doctor prescribes a new medicine for you. So some of the questions, especially some of our experienced patients might have is, what happens next? How do I get my medicine? And sometimes, how will I afford my medicine? So the first step in this process, what type of a medicine is it? Is this something that you would pick up at a regular pharmacy, so at your local CVS, your local Walgreens? Most of the time, the medications that are picked up at a regular pharmacy don't need insurance pre-authorization. However, there are always exceptions to the rule. So in the event that you find out that the medication does need insurance authorization, let your doctor know, because sometimes there might be a little bit of a delay in that information getting to the doctor's office. So if you let them know, hey, for some reason my insurance is requiring authorization on this medication, they can get started on that for you right away. So in special cases, so there are some medications called specialty medications or infusion medications. These medications actually likely need an insurance pre-authorization before you're able to get the medication. And one of the things they'll talk about in insurance authorizations is a formulary. So this is a list of medications that are covered by your insurance. It's important to note that these are medications that are preferred by your insurance. They still may need prior authorization, even though they are preferred by your insurance. Even if sometimes if a medication is not listed on the formulary, it may still be covered by your insurance in certain cases. Sometimes there are medications that aren't on formulary for a number of reasons, or there may be reasons that you can't take the medications that are on formulary. So it's always worth a shot to try and do an authorization request. And formularies sometimes require the use of generic medications or biosimilar medications, which I'm going to be talking about in the next few slides. So, biosimilar medications, this is something that particularly a lot of people who have vasculitis might be familiar with. So, the question is, because this is kind of a confusing new area for a lot of people, for biosimilar medications, are they just a generic? There's actually a significant difference between a generic medication and a biosimilar medication. So, with generic medications, we know that these medications have been around for a while. We've been seeing generic medications for quite some time now. These are medications that function the exact same way as the originator or brand name and is actually an exact copy of that brand name medication. The reason that this is an exact copy, it's a really small molecule. It's super easy to copy because it's usually produced by very simple chemical reactions. And with generic medications, there's a much less rigorous FDA approval process for them to come to market. When we're comparing these to biosimilar medications, same as a generic medication, it functions the same as the originator or brand product, but the molecule might look a little bit different. So if you looked at them side by side, they might look a little bit different. However, they've seen in studies that these medications function the exact same way. And the reason that this molecule might look a little bit different, it's a very large, complex molecule. And the way they produce these medications are very complex biologic processes. So we can't always get an exact image of the medication that we're trying to reproduce, but we do get something that looks similar and functions the same exact way. And for biosimilar medications, there is a very rigorous FDA approval process that they need to go through before they are actually approved as a biosimilar medication. And I know this is kind of a confusing slide, but this is the way I like to compare biosimilar and generic medications in terms of interchangeability, meaning can a pharmacy switch them easily between medication to medication? So for generic medications, you'll see we have brand name medication. With generic medications, because these are exact replicas of the brand name medication, usually a pharmacy can switch easily between the brand name to generic and sometimes to another generic if the first generic is not available. This is something that the pharmacies can do without a physician's say so, and oftentimes, results in a significant cost savings, which is why we love generic medications because they make medications more accessible to people. But in terms of interchangeability, when a prescription goes to the pharmacy, there's no difference between substituting generic one versus generic two. But then when we hop over to the biosimilar medications, there's an additional interchangeability requirement that the FDA has that requires additional studies for a medication to be considered interchangeable. So we have our originator medication or brand name medication. The first biosimilar might be studied to be interchangeable, meaning it can be switched readily with the originator product. But the second biosimilar actually might not be designated, might not have been studied as an interchangeable medication. So that medication actually can't be readily switched at the pharmacy between the originator medication. And I know this process seems quite confusing, but what it boils down to is generic medications can be switched very easily, whereas biosimilar medications, it's not always the case that they can be switched at the pharmacy. So interchangeability is something with biosimilars that is approved by the FDA. And the question, that we all have, why can generics be freely switched and biosimilars can't? And the reasoning is generics are exact replicas, and biosimilars may have a different chemical structure, but are considered to have the same action and effect. And why are some products interchangeable and why are others not? The reason for that is because additional studies are required for interchangeability, called switching studies, that actually show that there's no difference and no change when we switch somebody from the originator product to the biosimilar and vice versa. Um, this shows that the medication is safe and effective when switched with the originator product and gives an extra level of safety evaluation by the FDA that shows that it can be switched easily between the originator product. I also talked about specialty medications. So, a specialty medication, the definition is it's a high cost prescription medication, often used to treat complex chronic conditions. These are medications that are filled by a specialty pharmacy through your prescription insurance. Sometimes these medications are given through home infusion companies, and they're usually, most of the time, given at home. These medications with specialty medications, 99% of the time, they're going to require an insurance pre-authorization before they can be filled by the pharmacy. And your doctor's office usually is pretty aware of this and will try to do the pre-authorization before the medication goes to the pharmacy. Next up is infusion medications. So these are injectable medications that are given at an infusion center by a healthcare provider. Infusion medications usually, but not always, go through your medical insurance and not your pharmacy insurance. Sometimes infusion medications are given by a home infusion company. So again, with the home infusion company, sometimes it's through your medical insurance, sometimes through pharmacy insurance. But the general rule is these medications, whether they're going through medical insurance or pharmacy insurance, usually require an insurance authorization. And infusion medications are not usually filled by a specialty pharmacy. Usually they're provided by the home infusion company or the infusion center where you would be getting the medication.
Rachel, I'm sorry to interrupt you. Would you mind on your screen clicking hide? There's a little button that says we
Yes,
that'd be
got it.
great. Perfect, thanks.
So, talk a little bit about prior authorization or insurance authorization. So, why do insurance companies require a prior authorization for medications? The answer is oftentimes these are high cost medications or high risk medications that require additional monitoring that is needed for safety, and medications that are not on the insurance formulary. We talked about that before. Sometimes it might be appropriate that you use a medication that is not preferred by your insurance. So, prior authorization is also known as an insurance authorization or a pre authorization. You might hear it called many different things. This is oftentimes a health plan cost control process and has to be done before a medication can be dispensed by a pharmacy or given at an infusion center. What happens in a prior authorization is your doctor's office will share information with the insurance on why this medication is needed. And sometimes it requires multiple responses to requests from the insurance company. So it's not always a straightforward request. Sometimes the insurance company will have additional questions about why this is the best medication for you. Prior authorization, if it's very straightforward, prior authorization can take between 3 to 10 days, depending on the insurance plan, if it's approved. And usually they're approved for a year or less, sometimes more, sometimes less. Oftentimes they're approved for a year. But then we hit the my medication was denied. Now what? So there are two different ways that we can go if a medication was denied. Sometimes it's that the insurance company would prefer that you are on a medication that is in the same class as the medication that your doctor had prescribed, um, but it's just a different medication, so a different brand or a different medication in the same class. So if the medication wasn't on the insurance formulary, but there's an acceptable alternative, in this case, oftentimes we'll switch to the acceptable alternative that's on the insurance formulary that will be an easy approval through the insurance. However, sometimes the initial medication that was prescribed by your doctor is the preferred medication. There really aren't any other options. In this case, we do what's called an insurance appeal. So we provide additional information to the insurance plan on why this medication is the best option and why other medications are not appropriate. And sometimes this includes a peer to peer discussion with your doctor and a doctor from the health plan. So oftentimes they'll have a conversation about, why this medication is the best for you and why other medications are not an option. So sometimes even, with the best laid plans, we seem to be stuck. A lot of times manufacturers with specialty medications have programs to assist doctors' offices with insurance authorizations and appeals. So sometimes they will have a packet online that has sample letters of medical necessity or additional tools that the doctor's office might be able to use in their attempts to get the medication approved by the insurance. This information can be found on the manufacturer's healthcare provider website for the medication being prescribed. So, if a doctor's office is ever having difficulty, there are tools that are available on the manufacturer's site that they've provided to assist in doing authorizations and appeals. So next up, your medication's been approved and it's expensive. So we often see this with specialty medications that they get approved by insurance, but the insurance only covers a portion of a pretty expensive medication. So the first question is, who do you have your insurance through? Is this insurance through an employer or a health marketplace? We call these commercially insured programs. For commercially insured people, most manufacturers actually have something called a copay card program. You can sign up online or by calling the phone number on the website for the copay card program. You provide the copay card to your pharmacy, and usually there's a low copay associated with these copay cards. Um, and we've all seen it happen. If you have a copay card that stops working, let your doctor's office know. A lot of times there's something extra that we can do in order to get you access to the medication at a reasonable cost again. So next up, we have people who have Medicare. So people who have Medicare actually aren't eligible for copay card programs, unfortunately, due to Medicare rules. However, there are patient assistance programs where you can get the medication free of cost. These programs are income based, so you would need to provide financial documents and a form to the patient assistance program. The provider's office would also need to fill out some forms, and you would get the medication from a pharmacy that only manages the patient assistance program. So you wouldn't be getting it through your regular pharmacy. So now you got the medication. Now what? So a lot of times these medications, these specialty medications, are given by injection, or they might have a ton of side effects that you've read on Google. You might need some help learning how to use your new medication, and you might have questions about your medication. If the medication is filled through a specialty pharmacy, sometimes a pharmacist may reach out to do education before you start. But if you need additional help, please don't hesitate to ask. Your doctor's office knows that these medications are complex and might have some scary side effects that you can read about online. But oftentimes, these side effects are pretty rare. And we can walk you through the process and kind of give you a bit of additional information and clarity about the medication. So now something has changed. So you've had an insurance change, or the copays are now not affordable, or if you need a new insurance authorization. So sometimes insurance just decides, it's time for new authorization, even though your previous one didn't expire. If there's ever a problem, let your doctor know, because if you don't let your doctor know, sometimes it can go a significant amount of time before they find out that there's actually a problem. We would always rather you reach out to our office at the doctor's office and let us know that there's a problem before it actually becomes a problem and you're not able to get your medication. And I know I breezed through this presentation, but I like to end presentations oftentimes on a quote. So, taking on a challenge is a lot like riding a horse. If you're comfortable while you're doing it, you're probably doing it wrong. So this is a pretty good representation of the medication access process. Sometimes it's hard and sometimes it's a bumpy road, but always remember that your doctor's office has your best interest in mind, and we know that your medication is not going to work 100% of the time if you're not taking it. So we would much rather go through the process and walk this bumpy road with you to help you get your medication so we can help you get feeling better as soon as possible. And with that, I will hop off of sharing.